Good afternoon, everyone. So, our first speaker for today's session is Manleen Kaur, and she is a final year graduate student in our department working with Process Need2. And her area of research is development of a microscope based electrochemical platform for early detection of bacterial infection in biological sample. And today she is going to present her recent paper based on this title. And thank you, Manli. So is yours.
Thank you so much. Good afternoon, everyone. Again, I'm here to present my recent article, which was published in Analytical Chemistry. The title is Rapid Electrochemical Detection of Bacterial Sepsis in Cirrhotic Patients. It's a microscaffold-based approach for early intervention. The research basically focuses on the bacterial infections that are occurring in the biological samples. We have used here the sepsis as a term because sepsis was as the work was done in collaboration with ILBS. So they are working with the liver patients who are at end-stage cirrhotic conditions, and they are most prone to these sepsis conditions. So to reduce or to cut short any kind of culturing methods, like which I'll be explaining further, so we want to reduce that into a rapid early detection. So let's start with the explanation what sepsis means basically. Sepsis is nothing, it is just an inflammatory response which is produced by the biological agents. It differs from SARS in such a way that SARS can happen due to other agents, non-biological agents such as trauma or burns, whereas sepsis will be the cause of only and only biological agents such as bacteria, fungi, viruses, or any parasites. So these are the biological pathogens which affects your body, and your body is not able to fight them. It leads to sepsis. So here we are focusing in this research on the bacterial detection. If the bacteria is present or not in your blood samples or any biological samples. So how will we get that? What kind of so we have done a broad spectrum detection because when antibiotic treatment is given for sepsis patient, they are using a broad spectrum antibiotics. So we have done a broad detection. If it is gram positive or if it is gram negative, because the major difference lies in the NPS layer.
PMRF in Disease and Injury Mechanics Lab, headed by Dr. Ardav Chanta, and his research focuses on a study of frictional performance of worn footwear to mitigate slip and falls. Welcome, Shubham.
Hello everyone, good afternoon. I'm Shubham Gupta, as ma'am told you. So I'm a PhD research scholar under the supervision of Dr. Arnav Chanda. So recently I published this article which is on the effect of outsole wear on traction performance of nurses' footwear in hospitals. So it was published in Tribology Transactions. So what tribology is? Tribology is the study of friction, lubrication, and wear. So I have applied that tribology to the outsole, which is the footwear's outsole. And basically these footwears were selected in the hospital of the nurses' footwears. So why nurses? So because traumatic injuries due to unintentional slips and falls are prevalent in the healthcare sector. And it has also been noted that 26% of these cases are especially with the nursing care facilities, which is more than the doctors. And also there was a study which was conducted in AIMS. It concluded that the slip incidences were significantly higher in nurses and support staff as compared to doctors because they had higher frequency of movement across the workplaces, which was generally the ward corridors. It could be nurse station or the ICU entry, which is just the entry station of the ICU part. And also these problems can lead to minor cuts, skin abrasions, and also it can lead to serious problems such as fractures. It can also lead to dislocations and temporary loss of consciousness. So a bit of statistics of the or the global statistics. So slips and falls lead to 9 million cases worldwide in hospitals. It could lead to both fatal and non-fatal cases. And out of those, 6,50,000 cases lead to serious hospitalizations. And amongst those cases, 75% of the cases belong to low and middle income countries. And also 80% of these cases are reported from.
some of the content